Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population.
There are many reasons why Black communities are disproportionately being impacted by coronavirus, according to a range of experts I've spoken to. But one of the main reasons have to do with historic disparities between access to healthcare, education, information, and government resources in Black communities compared to predominantly white communities. Black communities are much more likely to have larger populations of low income individuals compared to uh, communities that are predominantly white. And that certainly affects the amount of resources in those communities that could make responding to coronavirus in a healthy way easier.
Communities of color are not only at higher risk, but if they do contract COVID-19, they are usually experiencing the most severe consequences.
The lawmaker mentioned that many communities that serve predominantly Black communities often only have a community health center as their medical provider, and that these places are already under resourced and ill-equipped to tackle the community's health challenges in a somewhat normal environment, much less a pandemic. Throughout American history, there's been great tension between Black communities and the healthcare industry. Incidents like the Tuskegee syphilis experiment, ongoing studies that show that Black women, particularly those who are pregnant, are less likely to be listened to by their doctors and healthcare providers, make seeking medical treatment very difficult for many Black Americans, and have led some of them to believe that healthcare professionals do not always have their best interests in mind.
Our data on the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible.
Black people are much more likely to work in the service industry, industries that haven't completely been turned upside down in this pandemic. We see food workers still going to work, and janitors and custodians and other service workers. And this often puts these employees in direct contact with risky places and workspaces. And many of them do not have the luxury of obviously working at home, or when going to work, socially distancing themselves 6 feet away from other people who may be infected. In addition to working long hours and being understaffed and overworked and underpaid, these stresses can make making decisions that would be healthier for you and your family